Well, hello, my name is Brandi Benton, and my current role is as the Director of the Office of Health Promotion at Emory University. So that's my full-time position in addition to serving as a faculty member for Southern New Hampshire. My trajectory into public health started at the CDC. When I finished with my master's program, my master's in public health, I really wanted to get to the CDC, and that's where I landed. And I worked there for 4 years in 2 different roles and was not really getting the experience that I thought that public health was. It was public health work, but I wanted more closer community work. And I transitioned into higher education, which was not what I planned on doing, but it was an opportunity to take a very specific community, a college campus, and do public health work. So I'm actually going to talk about my day in the life at CDC, because a lot of people who do public health work, that's like the place you want to go. You want to get to the CDC. And I learned a lot there because a lot of what I was doing was managing the process that got grants funded. So making sure the requests for those grants were out, receiving those grants, organizing them into a process so that they could be reviewed, organizing the reviewers, and then having those reviewers make those recommendations for that, and then sending those recommendations out, and then starting that cycle all over every year. So that was more of a cyclical type job, which was why I was removed from the work. I was reading all these great grants and all this great work, and I wanted to do that work. So that was more administrative and that was more removed. When I transitioned into higher education, and where I am now is doing more program planning. So thinking about the needs of the students regarding their health and well-being, around their mental health, creating assessments to say, well, what do they need? Building those programs based on what they already know, what they don't know, what they say they want, the trends we're seeing in the data, building those programs, and then implementing them, evaluating them, and then starting that cycle over. The good thing about that is it is very, it changes, even though students in a small period of time, 4 years, are the same group of students. Their needs change because they grow and they learn. So my day-to-day work is more about keeping an eye on the big picture of the health and well-being of our students and adjusting accordingly. Because I'm the director of an office, I'm really supporting my staff to make sure they can go implement while I stay visionary and look at the strategic needs of the office and adjust budgets and adjust other resources so that we can continue to do what we said we're going to do based on the assessments that we receive and the evaluations we receive. The good thing about public health is that there's so many ways you can be involved, and public health work is long-term work. One of the things that I like to encourage people who are trying to do this work is don't isolate or silo yourself into one particular topic area. One of my favorite kind of pieces of advice that I got young is that skills can be transferred, content can be learned. So get the skill base. If it's evaluation or assessment or research practices, anything that's skill based that you can take to any job is much better than when you just focus on a particular health issue. So some people want to go into maternal and child health, and that's where they just kind of drill down and hone in. And then another job comes up that they are really interested in, but they feel like they don't have the experience in it. If you can market the skills that you have without only highlighting the content, it makes you more marketable in this area, because a lot of the skills that you learn in public health can be transferable, and you can learn the content when you get there. So I think that's my biggest piece of advice, is explore, deepen your skill set, your skill level, and the transferable skills, and learn plenty of content as you go, either from job to job or from place, area, promotion, whatever that may be.